يعني كنا عاملين لايف برودكاست عن السكين ايجينج والسكين ريجوفينيشن مع المونوبوز. ودلوقتي ان شاء الله احنا هنكمل.
I'm back.
Yes, hi. Yes, you are back. So I think we are going to continue what we have been trying to do.
Yeah.
And as I mentioned in this particular patient, we can see that in her 2012 photo, she is looking much older than the photo in 2015, right?
Yeah. Yes.
So I think we can that her skin is looking much healthier, much better in after 3 years. Although we are supposed to see that she has aged 3 years, so she is older, but the skin is looking much better after 3 years because we continue to do the procedures which are anti-aging, which are restoring the structure and the function of the skin. So we can see how her skin becomes much healthier after 3 years. Mm-hmm. And this is her neck. We can see that even the neck is much tighter after that. So when we are doing the right procedures, when we are really doing what we are supposed to do to target the different layers of the skin in a healthy way, then we are going to be able to treat different age categories. We're going to treat different skin types and different skin conditions in a very healthy way. Now, back to the topic which we started with, Amy. Before the menopause, starting from the age of 20, we can start to do rejuvenation, targeting the epidermis.
Yes.
In the 20s, we are not having skin laxity, right? So we are going to do something to work on the epidermis, and this is something which can start as early as in the late 20s, mid-20s, yes, and late 20s. Then after that, we start to focus on the epidermis and the dermis because we have issues like acne scars, like large pores, like starting having fine lines. In this case, we need to target both the dermis and the epidermis.
Yes.
And then later on, in the late 30s and the 40s, when we have issues with the redistribution of the fat, then we can start to add something to tighten the skin. So we have in our clinics different technologies. The important thing is to select a technology for each layer of the skin. When we have patients who are having acne scars, for example, and they go to 4 clinics where they do microneedling, then they go for microneedling radio frequency, and then they go for a third place for fractional laser, and then they go for PRP injection. Actually, all of them are targeting only one layer of the skin, which is the dermis, which is not going to help. Instead, we are supposed to do different techniques in order to target the different layers of the skin. So this is how it should be. This is what we are doing in our practices and so on. After the menopause, we have different things which we need to keep in mind. One of them is when the estrogen is going to be declined, we'll start to have acceleration in the skin aging. So if someone didn't start till that time, it's time to start. But ideally, we don't wait till we have significant breakdown of the collagen. It's supposed to be anti-aging process. And if we started earlier, then it is going to be just maintaining what we have been doing. Yes. If someone didn't start till then, they are going to see a sharp decline in how their skin is looking and how they are feeling. So it's time to start those procedures in order to stimulate the collagen synthesis. Of course, during the time of menopause and around that period, they start to feel more dryness of the skin because of different elements, but one of them is the damage in the epidermis and other issues. Oxygenation of the skin is going to be much less. The circulation becomes much slower. So that's why it is really very important to, as you mentioned, to take care of all the aspects. Enough water intake, take the right supplements, do exercise, healthy diet with the procedures we are doing in order to achieve rejuvenation, restoration of the structure and the function of the skin.
Yes.
Another problem which happens during the same time is because of the hormonal imbalance, some people will start to have adult acne. So and sometimes they go into tracks where they keep using the acne medications and so on. Actually, having the hormonal balance is going to be the solution, not to use antibiotics and those things, because it's a chemical acne, not bacterial acne in many cases. During that time, they start to have some facial hair grow. And it's very important to highlight that when that happens, they should seek assistance immediately, because if they wait a little bit and the hair is becoming white, it's not going to be treated by laser. So because laser can target only the white hair. So that's something which should be dealt with as soon as possible, for sure. The fat distribution is going to change at that time, as we mentioned. We start to lose the fat from the face, from the neck, from the hand, from the breast, from the arms, and we get skin laxity, and then it increases in other areas of the body. So at that time, procedures which are leading to skin tightening with deep tissue heating are really going to help a lot and will be required.
Yeah. Yeah.
Bone density is going to decrease, so the supplements of vitamins and exercise are very important in order to avoid the osteoporosis and pathological fractures, and this is going to definitely improve how they feel as well. So all those are really very important issues to be considered around the menopause. However, the best advice is to not to wait till menopause happens. Let us start early, have rejuvenation, have anti-aging treatments, so that when we are at that phase, we are really going to overcome this period in a very easy manner, without feeling that we are spending so much money to try to resolve problems which are severe. Instead of that, let us do prevention, which is much better than treatment.
Yeah, prevention is key. That is number one.
Yes.
Definitely. And going back to what we started the last video with, is don't go towards the fillers and the Botox as being the saving grace for this, because it's definitely about, you want to make sure that the skin is nice and healthy and strong and functioning.
Yeah, that's very true. By the way, I'm not saying that there is no place for Botox and fillers.
I agree.
I'm just saying that those techniques shouldn't be the main thing we are depending on. They should be used for fine touches, but not the main thing to fix everything, because those who did that during the previous years, they are very unhappy today, and they look much older than their age. Whereas when we are using those as just fine touches, as we have seen in the photo of the patient I showed, we can get older, but it is not going to show on our skin and how we look.
Yeah. And I like to say too that when it comes to Botox, I definitely leave it in my clients' decision, their decisive hands. But I will recommend, if they have really deep lines on their forehead, that we might want to utilize the Botox to stop that dynamic movement while we're trying to correct the collagen expression. Because it's like a push-pull, right? Like you're trying to rebuild collagen, but if you're very expressive, then that's just going to keep hitting it.
The problem is that sometimes when we have expression lines which are aggravated or exaggerated, at a certain point they are going to leave not only dynamic wrinkles but static wrinkles as well. So when this is the situation, when the muscle tone is so strong, then it's better to use some Botox to soften it, so that we don't leave a static wrinkle, because this is going to be a permanent thing. Having said that, if I'm going to construct a plan, I would definitely work on rejuvenation first, and keep the Botox at a later stage. So I improve the structure of the skin, I improve the hydration of the skin, because then when I do the Botox after that, then it is going to be longer term, it's going to be more natural, and everyone will be happier. So if I have that to organize a plan, then I do rejuvenation, I work on the epidermis, on the dermis, on tightening the skin, and after a few sessions, then I introduce the Botox, not the opposite.
Yeah. Perfect.
Yeah. So it was a pleasure to be with you again, Amy. It's always very, very stimulating. I always appreciate your way of dealing with things, understanding things, and your sincere way in dealing with your clients. It's a pleasure to be working with you, and I hope all the audience enjoyed. And I think you saved the previous broadcast. Did you save it? Excellent. I'll be saving that as well, and I'll send you a copy of that, and let us post it so that who could not attend, then they can watch it later.
Amazing. So I'll send that to you right away, and I look forward to our next chat.
Yeah, great.
Thank you so much.
Thank you very much, Amy, and take care.
You as well. We'll talk to you soon. Okay, bye.
Bye-bye.